I'm Catherine Monty. I'm the National Director of ChildFund Philippines. Let me tell you a little bit about the Philippines. Philippines is an island nation. It's made up of 7,000 islands. It is a country where 40% of the population lives below the poverty line. It is a country with not much of a social safety net. So if you are not able to afford to pay for your health care, then you do not have access to health care. If you are a parent and you do not have money and you cannot afford to pay for school fees or books or supplies or uniforms, then your children cannot go to school. There are many, many, many children who are left behind, whose parents and whose communities are terribly impoverished, where there is malnutrition, where there is child labor, because children need to work to help support the families. What we are doing at ChildFund is we are working with children and their parents and their communities, and we are working with parents of very young children to help them understand how they can protect their children, little children, about nutrition and about safe motherhood and safe baby practices for young children, how they can stimulate their children very simply. We are also working with children who are between the ages of about 6 and 14, and we work with them differently because we hope that they're going to school. We help them go to school, paying school fees sometimes if we need to, helping them with school supplies, organizing them and their parents into community groups and support groups and parent associations to work with the schools, helping the schools to understand what is a child-friendly school, a school that protects children, that has the best interest of the child at heart. We also work with children from the age of about 15 to 24, and there's a very different kind of work and a very different kind of young person that we work with. We talk about livelihoods and how they will be able to translate. Well, we keep them in school, which is the most important thing. But there are many other things, and part of that is how will they make a living? What kind of livelihood can they expect? So we try to help give them programs that help them understand how to segue between being a student and education and finding a job and having a livelihood. Obviously, with young people and adolescents, we talk about adolescent reproductive health because that's very important. We want them to be healthy, we want them to be confident, and we want them to have the information that they need to make choices for their lives that will place them on the path to being successful. So I hope that I've given you a little bit of an understanding of what we're doing in the Philippines. We have 34,000 children that are enrolled in our program in the Philippines. They are not all sponsored. So I encourage you to go to our website, use the social media outlets to learn more about the Philippines if you would like to, learn more about ChildFund. But I need your help. I need more sponsors for our children in the Philippines.